Assalamualaikum and a very good day to everyone. We present to you our group project, the fungal nail infection. Meet my group members, which include myself, Hamka, Haris, Huda, Nisa and Alisha. In this topic, we are going to talk about the introduction of fungal nail infection, mode of transmission, clinical manifestation, routine diagnostic method, high-risk group, treatment and prevention of the fungal nail infection. For introduction, we got to know what are the disease and pathogens, where does fungal nail infection popularly occur, and shape or related classification involved. Fungal nail infections are caused by various types of fungi, including dermatophytes, yeast, and molds. The most common pathogens associated with fungal nail infections are dermatophytes. Dermatophytes are a type of fungi that can infect the skin, hair, and nails. Trichophyton rubrum, Trichophyton mentagrophytes, and Epidermophyton flocco are the three most prevalent dermatophytes that cause nail infections. Yeast, such as Candida species, can also cause nail infections. People with compromised immune system or those who have taken long-term antibiotic medication frequently acquire yeast infections. Molds such as Aspergillus species are less commonly associated with nail infections. In some circumstances, such as after trauma to the nail or in people who work in settings with high quantities of fungal spore, molds can develop. Onychomycosis is another name for a fungus that infects one or more nails. It is a common condition that results in fungal nail infection. The infection usually starts as a white or yellow spot under the nail. If left untreated, it can progress to the nail bed and cause thickening, discoloration, and deformation of the nail. Both fingernails and toenails can be affected, but toenails are more commonly affected. Fungal nail infections are present worldwide. About 10% of adults are affected by fungal nail infections, with high prevalence among the elderly. Geographically, location, age, gender, and underlying medical issues can all have an impact on the frequency of fungal nail infections. Onychomycosis has an 8.6% worldwide incidence. Incidence is greater in North America and lower in Africa and Asia. Underreporting and misdiagnosis of the condition may result in overestimation of the actual incidence. Dermatophytes are a type of filamentous fungi. They have septate hyphae, which means that their branching filaments have cross walls. Yeast are single-celled fungi that reproduce by budding. They are typically round or oval in shapes. Molds are a diverse group of fungi that grow as multicellular filaments called hyphae. It can either be septate or non-septate. They can be classified based on their appearance.
There are four modes of transmission that we have in fungal nail infection. The first one is direct contact, second one, indirect contact, third, fungal spores in the environment, and lastly is self-infection. The first one is direct contact. It spreads by direct skin contact or indirectly from contaminated articles on floors or in the soil. It also can be transmitted from person to person through direct contact. This can happen when an infected person touches another person's nails or when they use the same nail clippers or nail files. It also can be spread when sharing rooms and showers, while some infections are spread by sharing items such as towel. Second mode of transmission is indirect contact. Indirect contact occurs when an infected person shakes skin or nail fragments that contain fungal spores, which then contaminate surfaces such as floor, shower, or nail equipment. And the third mode of transmission is fungal spores in the environment. It is coming in with fungal spores that are present in the environment, such as in soil, on plants, or in the air. And for the last mode of transmission is self-infection. Self-infection spread from one nail to another on the same person. This can happen when the infection spreads from the infected nails to the surrounding skin and nails. Next, we are moved to the clinical manifestation. In clinical manifestation, we have three subtopics. First, the types of fungal nail infection. Second, signs and symptoms of fungal nail infection. And lastly is other diseases caused by the pathogen with description. So, first types of fungal nail infection is distal subungual onychomycosis. Distal subungual onychomycosis is a common fungal infection that affects the nails of the hands or feet. It begins at the tip of the nail and gradually spreads towards the base, causing the nail to become thick, discolored, and brittle. The nail may also separate from the nail bed, leading to pain and discomfort. This type is caused by a group of fungi known as dermatophytes. These fungi thrive in warm, moist environments such as locker rooms, public showers, and swimming pools. Risk factors for developing this condition including aging, diabetes, peripheral nervous system, and a weakened immune system. The second type of fungal nail infection is white superficial onychomycosis. White superficial onychomycosis affects the surfaces of nail plate. It's caused by a group of fungi known as dermatophytes which thrive in warm and moist environment. Risk factor for developing white superficial onychomycosis is include wearing tight-fitting shoes, walking barefoot in public areas, and having weakened immune system. The third types of fungal nail infection is Candida onychomycosis. Candida onychomycosis is caused by the Candida species of fungi, which are commonly found in the environment and on the skin and mucous membranes of humans. It can affect both fingernails and toenails and can present as a thickening, discoloration, and distortion of the nail. The nail may also become brittle and crumbly, and the surrounding skin may become inflamed and itchy. Risk factors for developing Candida onychomycosis include diabetes, a weakened immune system, and a frequent exposure to water. Those who have previously been treated with antibiotics or corticosteroids may be at an increased risk for developing this infection. And the last types of fungal nail infection is proximal subungual onychomycosis. Proximal subungual onychomycosis is the less common form of onychomycosis, accounting for approximately 3% of all fungal nail infections. Typically begins at the base of the nail and gradually spreads toward the tip. It is caused by a group of fungi known as dermatophytes which thrive in warm and moist environments. Risk factors for developing proximal subungual onychomycosis include a weakened immune system, nail trauma, and prior exposure to fungal infections. It is more common in people who have HIV or AIDS, diabetes, or a history of chemotherapy. The signs and symptoms of fungal nail infection is first, we have discoloration of the nail. The nail will turn to white, black, yellow, or green. Second, the nail will thicken and distort. It may become an unusual shape or texture and be difficult to trim. Third, the nail will be pain or discomfort. It will particularly when using or placing pressure on the affected toe or finger. Fourth, the nail will be brittle or crumbly. The pieces of nail will break off and come away completely. Fifth, the nail will be deformed. The shape of the nail may change, becoming curved and or distorted. Next, the nail will be separated. The nail may separate from the nail bed, causing pain and discomfort. And lastly, the nail will be odor. The infected nails may produce an unpleasant odor. We move on to the 3.3, which is other disease caused by the pathogen with description. So, the first disease is athlete's foot. Athlete's foot is a fungal infection of the skin on the feet, typically between the toes. It can cause itching, burning, and scaling, and can also spread the two nails. The second disease is jock itch. Jock itch is a fungal infection of the skin in the groin area. It can cause itching, redness, and a rash, and can also spread to the two nails. The third disease is ringworm. Ringworm is a fungal infection of the skin that can affect different parts of the body, including the scalp, body, and feet. It can cause a circular rash with red, scaly edges and can also affect the nails. And the last disease is tinea versicolor. Tinea versicolor is a fungal infection of the skin that causes discolored patches of skin, typically on the chest and back. So that's all from me. I will pass the next presentation to the next presenter. Thank you.
Okay, let's move to the routine diagnosis method. So here I will mention three diagnosis methods. There are microscopic directly, fungal culture, and polymerase chain reaction test, or also known as PCR. Microscopic directly is to diagnosis by preparing and studying nail samples. The technique using 20% of potassium hydroxide preparation in the MSO by depending on the types of the onychomycosis. Second is fungal culture. This method to identify the specific pathogen which caused by onychomycosis. This method also to differentiate between dermatophyte and non-dermatophyte moles using two types of growth medium, one with and without cyclohexamides. To do this method, a specimen should be taken from nail clipping when patient has not taken the antifungal medication for at least 2 weeks. Move to the third method is polymerase chain reaction PCR test. This technique to detect fungal DNA from affected nails. It can differentiate between dermatophyte and non-dermatophyte PCR technique is highly sensitive that uses species-specific primer pairs based on 285 ribosomal RNA genes. Okay, next slide is about morphological features. So there are macroscopic features, microscopic features, specialized staining technique in fungal DNA sequencing that used by the lab technologists to identify species of onychomycosis. Move to macroscopic features. The macroscopic characters of the fungal colonies collected from the nail samples, such as colors, texture, and growth pattern, are investigated. While some fungal species may produce pigments that give colonies color, others may grow slowly or quickly. Okay, move to the second, microscopic features. Under a microscope, the fungal colonies are examined to look for microscopic characters like the presence of hyphae, spore, or other reproductive structures. The species of the fungus can be determined by looking at the size, shape, and arrangement of the structure. Move to the third one is specialized staining technique. These two of further aid in identification. Lab technologists can use specialized staining methods like periodic acid shift or shock as a PAS stain or lactophenol cotton blue. This stain help in highlighting features, making it easy to differentiate between several species. Last but not least, fungal DNA sequences. Lab technologists may use molecular methods like fungal DNA sequences. The fungal species can be identified more precisely and specifically using this procedure.
Assalamualaikum warahmatullahi wabarakatuh, and hi to Doctor and my fellow friends. As for my part, I will explain to you the high risk group for fungal nail infection. For the first high risk group is older adults. As people age, their nails can become more bitter and prone to fungal infection. Additionally, older adults may have decreased circulation to their feet, which can make it more difficult for the body to fight off infection. The next high risk group is people with weakened immune system. Individuals with weakened immune system, such as those who has HIV or AIDS or undergoing chemotherapy, may be more susceptible to fungal infection. Other than that is people with a history of nail infection. Individuals who have a previous nail infection, such as athlete's foot or previous fungal nail infection, higher to get again develop the new infection of develop new fungal nail infection. Moreover, the high-risk group of fungal nail infection is individuals with athlete's foot. Athlete foot is a common fungal infection that can spread to the nail if it left untreated. Furthermore, fungal nail infection, the high risk group of fungal nail infection is people who sweat heavily. It is because particularly in their feet or hands, it is more likely to develop the fungal nail infection. Last but not least, people who wear tight shoes or socks is one of the high risk group for fungal nail infection. It is because shoes or socks that tight not allow for proper ventilation, and it can create a warm and moist environment that is favorable for fungal growth. So that is all from me. Thank you.
Hi, my name is Muhammad Harid Daniel bin Muhammad Faizal. My mention number is 158 and 773. Today, I would like to present about the treatment and the prevention of the disease, which is a fungal nail infection. There are a few treatments that can be included to treat the fungal nail infection. The first one is antifungal medication. Antifungal medication have both topical and oral medication that are commonly used to treat fungal nail infection. Topical medication include creams, lotion, and nail lacquers that apply directly to the affected nails. Oral medication are prescription drugs that are taken by mouth and usually the patient who have allergies in their skin when they apply topical medication are suggested by the physician or doctors to take oral medication that are prescribed by the nurse when certain symptoms are shown in the patient's skin, such as redness, itchy in the area near the nail infection. And the most commonly prescribed oral antifungal medication is terbinafine, but other options include intraconazole and fluconazole. Second treatment that can be included to treat a fungal infection is laser therapy. Laser therapy may be recommended as a treatment for fungal infection. This involves using a laser to hit and destroy the fungus that is causing the infection. Laser therapy is considered safe and effective, but it can be expensive and may not be covered by insurance. But mostly, the patient will ask their physician or their doctors, and this is the common question that usually being asked by the patient, which is how long does it takes to get rid of toenail fungus with laser? As you know, the fungal nail infection usually affect the toenail, and the answer it takes anywhere between 8 and 18 months for a patient to see positive result after undergoing therapy to treat their toenail fungus. Toenail take at least 6 months to full grow out, so it takes a little bit of time for the disease portion of the toenail to grow out healthy and heal. The last treatment that can be included to treat the fungal nail infection is surgical nail removal. In severe cases of fungal nail infection that do not respond to the other treatments, surgical nail removal may be recommended. This involves removing the affected nail so that a new healthy nail can grow in its place. This is usually only recommended if the infection is causing severe pain or other complication. And they may have the complication because with any surgical procedure there are some risks, and it include infection following the removal of the nail, a local reaction to the chemical applied to the nail bed, regrowth of the removed nail, or maybe the distortion of the remaining nail following partial removal. And some of the patient may ask, is surgical nail removal painful? Reassuringly, the only slightly painful part is the injection used to administer anesthetic. Once the toe or the finger is numb, you will not experience any pain while the nail is removed. There are a few prevention that we can use in our daily life so that we can prevent fungal infection. The first prevention that we can use is wear breathable shoes and socks. Choose shoes and socks that allow your foot to breathe and stay dry, and avoid shoe made of synthetic material and option for those made of breathable materials such as leather, canvas, or mesh. Wearing socks creates a barrier between your shoe and feet, which is easily prevents skin conditions such as athlete's foot, callus, and fungal bacteria. Athlete foot is a contagious form of fungus which can infect person, usually resulting in itching, burning, dry, and flanking skin. And why we need to choose a breathable shoe so that the ventilations in the shoe area is increased so that we can prevent the warm and the moist environment so that the bacteria cannot spread faster than it usually be. The second prevention is keep feet and hand clean and dry. Fungi thrive in warm and moist environment. After showering, make sure to thoroughly dry your feet and hands, especially the space between your toes and fingers. Washing hands can keep you healthy and prevent the spread of respiratory and diarrheal infection. Germs can spread from person to person or from surface to people when you touch your eyes, nose, and mouth with unwashed hand, or maybe you prepare or eat food and drink with unwashed hand, touch surface of object that have germs on them, or maybe blow your nose, cough, or sneeze into hands and then touch other people's hands or common object. The third prevention that we can use to prevent the bacteria attach ourselves in our daily life is avoid going barefoot on the public places. Fungal infection can be picked up in the public areas such as gyms, pool, showers, and maybe in the beach. And wear shower shoes or sandals to protect your feet and avoid going barefoot in these areas. If you want to know, person with diabetes should completely avoid going barefoot anywhere, and especially in public areas or the public places, because diabetes are prone to developing peripheral neuropathy due to high blood sugar. This can make them unable to sense heat, realize that their foot may be injured or hurt. A diabetic is not more prone to infection than everyone else, but it can be difficult to get rid of an infection once they have it. Infections are severely dangerous for diabetes, who could even face amputation as a result. And the last prevention is do not share personal items. Fungal infection can spread through sharing items like nails, slipper, files, and shoes. And please avoid sharing personal item and keep your own item clean and well maintained. And I think that's all from me. Thank you.